Hello everyone, my name is Choong-Kyun Noh. I work in the Department of Gastroenterology at Aj University School of Medicine, South Korea. It is an honor for me to introduce my research to the eminent journal Gastrointestinal Endoscopy. Before introducing my research, I would like to thank our research team and the staff of the endoscopic room. My research title is Comparative Diagnostic Performance of Rapid Urease Test with the sweeping method versus tissue sampling method after H. pylori eradication. The rapid urease test is a commonly used invasive method for H. pylori detection, in which tissue samples from the gastric mucosa are placed into a commercially available analysis kit, with results interpreted from a color change that requires minutes to hours. In my second year fellowship, I thought a lot while performing biopsy sampling for rapid urine test during endoscopy. In our center, we performed the biopsy sampling twice at different locations to increase H. pylori detection rate. However, I had a doubt about this. Why perform biopsy sampling if H. pylori is not lodged in the gastric tissue? Since H. pylori is a non-invasive bacterium that lives in the mucous layer, the essential component for the urease test is the mucus itself, with mucosal and submucosal tissues actually not needed for diagnosis. For this reason, rapid urease test does not detect H. pylori directly, but rather indirectly via the detection of urease, which is expressed by the organism. This raises another question. Why perform tissue sampling even when the sampling error is known? Moreover, it has been reported that a large number of samples increase H. pylori detection. But I disagree with this suggestion because mucosal damage and oozing of fluid occur during sampling. As H. pylori is a non-invasive bacterium dwelling in the mucous layer, swimming in the surface of the stomach, why not sweep it up and contain it? Next, I considered what I could use to contain it and whether I could use an existing commercial rapid test kit. In our center, when performing cancer workups, we make 6 millimeter surgical drapes and use them as markers to measure the size of the tumor. I tried using it as some material, and exquisitely, this size marker fit perfectly into the tissue slot of the Lapidurase test kit, and I shouted, Eureka! We named this method Rapid Urease Test with the Sweeping Method. In year 2020, we introduced this diagnostic method in the general population and evaluated its performance. This video is a demonstration for sweeping method. First, grab the swab material with endoscopic forceps, sweeping 5 times at the antrum, then another sweeping 5 times at the gastric body. You can see there is no mucosal damage. This method is very simple and safe. This study compares the diagnostic performance of sweeping versus tissue sampling method in patients receiving H. pylori eradication treatment. We compare the two methods after H. pylori eradication for several reasons. First, we attempt to confirm the diagnostic performance of the sweeping method, which demonstrated high sensitivity even when the bacterial load was low following eradication treatment. Second, given the low sensitivity of the conventional tissue sampling method, the urea blast test is preferred after eradication treatment. However, we assess the potential role of the sweeping method, which exhibits high sensitivity even in patients requiring endoscopic follow-up as an alternative to urea blast test. As a result, rapid urase test with the sweeping method for H. pylori detection has a higher sensitivity than the biopsy sampling method after eradication. The detection time for H. pylori infection was shorter, using the sweeping method than using the conventional tissue sampling method. In addition, this method is safe as it does not damage the gastric mucosa. This study has some limitations. The first positive result have been obtained. This is because H. pylori is not the only urease producing strain. If a study is performed only in patients with confirmed H. pylori infection, more accurate result may be obtained. In addition, the appropriate material for swab has yet to be determined. It is ideal to collect a large number of H. pylori samples with a small number of sweeps. However, further studies are necessary to determine the appropriate number of sweeps. In conclusion, rapid urine test with the sweeping method using some material showed high sensitivity, accuracy, and rapid detection of H. pylori following eradication. This method is cost effective and is not associated with adverse events such as bleeding due to biopsy sampling. Therefore, the sweeping method can replace the existing conventional tissue sampling method as a confirmatory test following H. pylori eradication and is a potential alternative to UBT in patients who require endoscopic evaluation. Finally, we greatly appreciate all the co-investigators for their contribution to this study, and special thanks goes to my senior professor, Kim Young Lee. Thank you for your kind attention.